afternoon, sorry. Thank you for joining this session. My name is Mary Kate Haver. I'm the medical librarian at Moffitt Cancer Center and Research Institute. We appreciate everyone joining. I'd like to take the opportunity to thank our presenters, Artis Hanson, Assistant Director, Research and Education, University of South Florida Health Libraries, Schimberg Health Sciences Library, and Florida Blue Health Knowledge Exchange. Okay, and Olivia Leonardo, medical librarian and narrative medicine instructor, New Morris Children's Hospital, instructor of medical education and at the University of Central Florida College of Medicine. Just a quick slide, one or two slides about the FHSLA collaboration, TBLC collaboration. Again, these sessions are held every month, the second Tuesday of the month from noon to 1. The idea is that we share and exchange knowledge about health resources with the community. We would, as medical and health sciences librarians, we would like to collaborate with public librarians to be able to extend the networking and support communities' education. And let's see, these sessions are open to all FHSLA and TBLC members. They are recorded. You'll have access to them following this session and also for the next calendar year. At this time, I'd like to introduce Artis Hanson. She's going to discuss mental health awareness.
And share my screen.
I'll stop share. Okay.
Hopefully everyone can see my screen. May, as you know, is Mental Health Month. And some interesting facts are that essentially 1 in 5 people live with a mental illness. And the current advocacy position on mental illness is that 5 in 5 people deserve treatment and support because mental illnesses are one of the most frequently underdiagnosed and undiagnosed illnesses. Illnesses affect people across all age groups, across all populations, across all ages. Mental Health America issues a wonderful State of Mental Health in America report every year. And the stats coming out even before COVID, we were looking at 19% of adults during the course of a year experienced a mental illness, which is over 1.5 million people in the US affected by a mental illness. Since last year, we've had an increase in suicidal ideation. We also have a significant number of adults with mental illnesses who have not been able to receive treatment. These numbers have not declined over the last 10 years. So approximately a quarter of the people who have a mental illness are unable to receive treatment or to receive sustained treatment over time. Youth in the US, there has been an increase in severe depression among youth, much of it attributed to COVID, but the fact that we have 60% of youth who have been diagnosed or would be diagnosed with a mental illness who do not receive any treatment at all due to lack of services, lack of funding. Even in the United States, 1 in 3 individuals tend to go without treatment. Only 27% of youth who receive treatment receive consistent care. And this is probably one of the biggest issues around provision of treatment for persons with mental illnesses. And of course, based upon our current payer system and our healthcare system, approximately 11% of Americans with mental illnesses are uninsured. And this has actually increased since the passage of the Affordable Care Act. And much of the decrease in access to care and the decrease in Americans who are uninsured were attributed to decisions made by the previous administration. But when we think about mental illnesses, the converse of that from a mental health side, we're looking at emotional, psychological, and social well-being. And our mental health affects how we think, how we feel, how we act, how we interact. It has ramifications across everything that we do and everything that we are. Mental illnesses exacerbate physical illnesses. Physical illnesses can exacerbate onset of mental illnesses. And when we are looking at children and adolescents who are underdiagnosed or undiagnosed or misdiagnosed, particularly with mental illnesses, we are looking at lifespan and developmental issues. We have consequences, ramifications into early adulthood, and into old age. So keeping a focus on mental health and mental wellness and mental awareness is really paramount. When we're looking at mental health awareness, we're planning on looking at reducing risk and building resilience. So you need to be informed, you need to be screened, and you need to get help. So we start with prevention, as with any good public health or population health perspective. So there are many places to have confidential mental health screenings. If you are concerned about your state or state of a family friend or family, the Mental Health America has a number of screening tools for different types of mental illnesses. If you meet these indicators, then it's going to recommend that you seek assistance. So if you're not sure, this is a nice way to be screened confidentially and then go and address specifically those symptoms that were identified in the screening with a mental health provider. Early intervention is absolutely key to a correct diagnosis. It can take up to 10 years to get a correct diagnosis and effective treatment. So the earlier you can diagnose, the more likely it is to be more contained and less distressing, and starts the trajectory of care in the appropriate way much more quickly. So always, if you are overwhelmed, if you feel things are out of control, if you're unable to be calm, you're overstressed, over anxious, depressed, etc., and this lasts for a period of weeks, the most important thing you can do for yourself is to seek help from a mental health professional or to see your primary care provider to be referred to a mental health professional. So screening and early intervention is key. Once you're in a treatment setting or working with a series of providers, you need to know your choices and supports. And this again goes back to being informed. There are clinical services that you may have access to. There are medications that are extremely effective to alleviate the symptoms of mental illnesses. There are peer supports. You can be part of a peer community. There are numerous counseling options that are out there, family supports, and many, many different types of therapies that have been seen as best practice, evidence-based practice, and have been proven to be effective. In addition to the clinical services and supports that you may receive, it is also important to know that if you have a mental illness or family member who does, that there are other supported services that are available to you. There are supported education services. Many of this can be built into an individualized education plan, particularly important for children and adolescents. There are supported employment opportunities where if you are new to the workforce or you have trouble retaining a job because of your mental illness, that you can go into supported employment programming where you can shadow someone to see about the constraints and challenges and opportunities within a particular job setting, that you can receive additional training and supports and case manager to help you acquire a job and stay employed. And finally, there are also supported housing options. Again, because many people with severe mental illnesses, serious mental illnesses, have reduced learning opportunity, primarily because of recidivism, into a serious state of mental illness and inability to function effectively. So, making these options available is an incredible societal support to allow people to become fully functioning and actively engaged members of the community, which I don't think we can stress enough. Common symptoms when talking about getting informed in screening. If you have changes in your sleeping or eating patterns, if you have difficulty sleeping or concentrating, if you feel like you're hitting a wall, oftentimes, if you have a worsening of chronic health conditions, if you have been prone to depression or anxiety and it gets worse, if you find yourself using more drugs, if you're drinking more alcohol, if you're smoking much, much more, this could also be symptomatic of an increased state of mental illness. If you're very concerned and you're fearful about your health or the health of others around you, anything that is an increase in a change or a change in behavior, these are often very early indicators important to address. If you're looking at children and adolescents, we're looking at children who cry a lot, who become easily irritated. If children's behaviors start to regress, they could be starting to suffer anxiety and depression or depression. Worrying, sadness, etc. Again, sleeping and eating habits, irritability and acting out behaviors, poor school performance, lack of engagement and involvement. Again, difficulty with attention and concentration, not engaging in activities that the child, the adolescent, or the adult previously enjoyed, or if we have unexplained headaches or body pain. These are common symptoms. Recognizing them and just saying, well, they've been persisting longer than they should. I need to see someone is the first step to ensure that you receive an appropriate diagnosis and you're able to receive the appropriate treatment. There are a number of common interventions and treatments that are out there. There are numerous therapies, everything from cognitive behavioral therapy, trauma-informed therapy, numerous types and models. And they're generally provided by psychologists, licensed clinical social workers, pastoral counselors. If you're in a faith-based preference, there are pastoral counsels out there, marriage and family therapists. Some psychiatrists provide therapy in addition to medication. You can also receive therapy in an inpatient, outpatient setting and in hospitals. Medication are not cures for mental illnesses, but just like medications that individuals take for physical illnesses such as diabetes, they can treat the symptoms of the illness. As with any kind of medication, each of it has benefits, risks, and side effects. It's important to remember if you are going to be on medication or you're being in discussions around taking medication, it can take up from between 6 to 8 weeks before you're at a therapeutic dose within your blood stream for the medication to have full effect. So it's not going to be, I take a pill, I feel great tomorrow. Medication is provided by psychiatrists, medical doctors, nurse practitioners, and physician's assistants. There are some other licensed practitioners who are able to prescribe as well. Peer support services. Peer supports services and peer support counselors are incredibly helpful and supportive in learning how to recover from mental illnesses, because here you have a community of individuals who have life experience in this. So there's information on coping, family coping, etc. It's just a wonderful kind of support system that is out there that is commonly seen as a good evidence-based intervention. And peer support is provided by certified peer specialists, peer supporters, support groups such as the Depression Bipolar Support Alliance, Project Recovery, etc., and other online support communities. Finally, we're looking at community-based services. And community-based services are team approaches, and they're going to be those services that will provide the supportive programs in education, employment, and housing that are going to be focused on building your ability to be in a successful recovery program. So you might be an individual or group therapy, there'll be case management, and as I said earlier, the supported programs. They're usually provided through large or small community organizations. And while some may work in an office, many times the treatment can be provided at your home or within a natural environment. These are provided by the local mental health associations, community mental health treatment organizations, and programs. Complementary and alternative medicine is also seen as a common intervention treatment. Probably about 40% of Americans use healthcare approaches that are outside of what we consider mainstream Western or conventional medicine. These can be provided also by doctors, pharmacies, and sometimes peer groups upon the internet. The suggestion is if you're going to always be taking any kind of supplement, you need to discuss this with your physician, as well as other complementary alternative treatments. So your doctor or your provider is aware of what you are doing to help manage your illness. Finally, we're looking at self-care, which looks at self-managed programs such as beating the blues, daily exercises, activities that can help alleviate and have a moderate effect on depression. And again, if you want to engage in self-care activities, if you're working with a peer group, community-based services, or whichever provider you may be seeing, discuss what you can do as a self-care program with them as well. So again, your providers and your supports know what you are doing to help manage your mental illness better. There is one caveat around interventions and treatments, which is why are so many individuals who don't have consistent care for mental illnesses, and that deals a lot with the reimbursement rates and the coverage provided by health insurance. Another thing to keep in mind if you're going to be seeking interventions or treatments is that nationally, the stats are there's one mental health provider per every 790 adults. So it may be difficult to find someone you can see who will accept your insurance coverage. Or if you can be in more of an integrated care system where your primary care provider may be able to network you to someone who can provide the services and supports that you need. But you need to just accept the fact it's going to take some time, possibly to get into effective treatment. And it is worth the time and the effort, however, to get into treatment. And this brings us kind of into a circle around what libraries can do for mental health. Bibliotherapy has been shown to be an effective therapeutic approach using literature that can be adapted or used to supplement other types of therapy. At the Florida Mental Health Institute, when it still had a residential treatment program, the client library, which was part of the institute at the time, was actively engaged working with the case managers on the unit and with the day treatment. Clients coming in. So the emphasis of the client collection was heavily on first-person accounts. First-person accounts are essentially autobiographies of individuals who are telling about their lived experience with mental illnesses. And it's more than just a description of symptoms. You have a better understanding from a first-person account of what families and individuals go through in learning about mental illnesses, being diagnosed with mental illnesses, receiving treatments, going full circle around and being re-diagnosed. The stories are very compelling. They talk about struggles, they talk about hope, they talk about recovery, the whole panoply of human experience. I think perhaps one of the most important components of a first person account is it places mental illness in a real world context. And it clearly shows how someone's life has changed since they received a diagnosis, since they've started treatment, the issues around maintaining and managing a disease, just as we have the stories around managing physical illness such as diabetes and heart disease and cancers, et cetera. And we read stories about how they have been able to overcome the obstacles, et cetera. The same thing happens when you're reading the first person accounts around mental illnesses. And I think they can be a very hopeful option in trying to understand how you suddenly manage your life with a chronic ongoing disease, which can be treated effectively, which does require engagement with the healthcare system, but can, at the end of the day, allow you to have a better quality of life. And that there are a number of resources available. This is just a sampling of them. Of course, Mental Health America and the National Alliance for the Mental Illness, NAMI and MHA are the two premier resource sites in the United States. They have directories of local providers. They have directories of the local support groups that they have throughout the country. Disability Rights Florida, if you have questions about treatment or service providers, they're a wonderful resource. When we're looking at peer support services, Project Return and Vincent House, which are two exemplars here in the Tampa Bay area, Project Return here in Tampa, Vincent House, which is in Pinellas, and I also believe in Pasco County now, are essentially run off the certified clubhouse model. And the clubhouse model is very much focused on peer support and peer recovery and engagement in supported employment and supported education. Clubhouse International also has a directory of other materials within the United States and internationally of certified clubhouses. Depression Bipolar Support Alliance is probably one of my personal favorite support groups in the Tampa Bay area. They're actually wonderful. And let's not forget the importance of the Florida libraries, because librarians are wonderful at helping people get to resources and are pointing them in the direction of where they need to go to find more information. And I will end here and set the stage for Olivia.
Thank you, Artis. Olivia, if you'd like to start, we will take questions at the end. So if you have any, be sure to post them in the chat, but we'll definitely follow up at the end. So please welcome Olivia D. Leonardo.
Hi, everybody. Thank you so much for inviting me to speak today. And Artis, I really enjoyed your presentation. Thank you. Obviously, an extremely important topic. So part of what I wanted to talk about today in relation to mental wellness and also to Artis's second to last slide, which talked about bibliotherapy and the importance of story. I wanted to share with you a little bit of the work that I do in the field of narrative medicine, both at Nemours and at the UCF College of Medicine. You may be familiar with the field. It started in Columbia, at Columbia University in the late 90s, so it's relatively new. Dr. Rita Sharon, an intensivist, became interested in the stories that her patients were telling her. And to make a long story short, she sought a degree in literature and then began speaking to others about what she had learned. And she started the field of narrative medicine, which is now under the auspices of the Columbia's College of Physicians and Surgeons. So what it is basically looking at story through the humanities, really all forms of the humanities. Could be prose, poetry, drama, film, dance, fine art, in order to get a more nuanced understanding of the stories that patients are telling us. And although narrative medicine is very focused on the healthcare field, I find, based on the sessions that I've done over the last 7 years, that it's applicable to other fields as well. Looking at stories and talking about them and writing seems to confer a benefit onto everyone who attends, not just doctors and medical students and healthcare team members, which is my usual audience. So in my sessions that I conduct with Nemours faculty and our medical students and residents, what we typically do is I pick a piece for us to talk about. We encounter it together in the room during our hour session, and then we talk about it. And so what I thought I would do today is share a piece that I recently found and used as part of the curriculum. It's actually a series of comics. Let me just share my screen. Just take me a moment. Okay. So what this is it's called Invulnerable, and it's chronicling experiences of different people all over the US that they've had with the pandemic, with COVID. And it was an initiative started by the Center for Investigative Reporting. They teamed with cartoonist T. Bowie. You may know her. She wrote a graphic novel, The Best We Can Do. She's a very gifted illustrator. And what they did was, starting about a year ago, they started releasing these comics online every 2 weeks, I believe. And each comic was meant to tell a story of a person and their experience of the pandemic. So what you're seeing are the names of the protagonists in each comic, and just a little quote from the interview itself. So what we do in the narrative medicine session is usually I ask folks to kind of look through them and then pick one that just piques their interest, either based on the illustration or based on the quote. And then I just click on it. I can start with this one and read this one out loud, and we can talk about it a little bit. This is one that I find in my sessions that people often are drawn to. And it's quite short. So what I do is I usually read this one out loud, and then I ask others if they have other comics they'd like to hear from this series, then they can read them out loud, and then we talk about it. So I'll just share this with you guys, and then we can, if there's interest, we can open up the floor to sharing a few comments about our impressions of this piece. So the title is "My Daughter Died Giving Her Heart Helping." It was, looks like it was published about a little less than a year ago in June. Zenobia Shepard's daughter, Leilani Jordan, worked at a giant grocery store in Largo, Maryland for 6 years through a program to employ people with special needs, including during the early weeks of the pandemic. When she was a little girl, she used to always reach for butterflies whenever they would fly past. She never wanted to leave customers not having help they need. She liked to help the seniors. She wanted to ultimately become a manager of a grocery store. They didn't protect her. She said, "Mommy, there was no gloves, there was no face mask." "Okay, Leilani, you don't need to go to work." She said, "Mommy, if I don't show up, I'm going to lose my job." Giant said the CDC was not yet recommending masks on Leilani's last day, and staff were allowed to wear gloves at that time. She got deathly sick to where she could hardly breathe. She had a strong case of COVID-19, and she didn't stand a chance because it already had gotten a hold of every area that she needs to survive. I couldn't visit her in the initial COVID unit, but I was able to FaceTime her, and she left me a video of how she felt that's very dear to me. Leilani died at age 27 on April 1st, 2020. After her death, Giant Foods mailed the family her final paycheck. It was for $20.64. My battle is with society. Why are we making it seem as though because somebody has a condition of any kind, that makes it okay for them to get coronavirus? That's not humane to me. My daughter died giving her heart helping, but God is good and God knows what my baby did. That's why God gave her wings. God's going to watch out for you. He's going to take care of you. So that was the end of this particular comic that we chose, Zenobia, or that I guess I chose for us to start with. And then what I do in these sessions is I just kind of open up the floor to the room, and I'd like to do that now if it's okay with everybody, to just kind of share your impressions of anything that stood out to you. And the wonderful thing about graphic novels and comics is that you have both the text, the words, and the images to think about. So if there was anything in the any particular panel that stood out to you, or anything that resonated with your own experience, I don't know what the right protocol would be for, I guess if you could use that, you could use the raising your hand icon, or you could just unmute yourself to speak, to share any thoughts that you have about this. Does anyone have anything they'd like to say?
Olivia, that was a very moving piece. It's a lot to take in, and
Yeah.
there's so many areas to focus on. So anyone, please feel free, or if you'd like, you can post a question to the chat or a comment, and we'll be sure to share it. Actually, one question is, are the comics available free online? Or do you purchase access to them?
So this particular resource and many of the ones that I choose are available for free online. Especially during the time of this pandemic, there are a lot of graphic medicine resources online that are available that are really terrific. Comics have really exploded in the last, I would say 10 years, especially as a medium for telling, for sort of like healthcare related memoirs, people talking about their experience with illness. And I find, I don't know, I think we as humans have very visceral responses to images. And when I talk to students and other healthcare team members that come to my sessions, these sessions with the comics tend to really, they tend to be very provocative. People tend to respond to them quickly. And so it's a medium I use often. And this resource is free online, as well as, well, there are lots of others too. I tend to choose things that are available for free, and then just sort of do exactly as we're doing now, just kind of share it. And then people in the room, we all talk about it together. And these stories aren't all medical. And narrative medicine pieces don't have to be medical. It's a way of sharing an experience. It's a way of kind of recognizing our own filters that we come to the table with when we tell a story and when we listen. Because, you know, you can have one piece and you can have several people talking about it, and one person may have a completely different take on it than everyone else in the room, or there could be several different opinions about something, and it can be really enlightening to hear those things. And Columbia, they have these workshops frequently with faculty, and they find that it helps build stronger morale among team members, and that people tend to work better together. I think because it engenders this kind of bonding when you have these sessions and people talk about what they see. So
we actually have another comment. As difficult as the subject is to digest, it's easier to do so in comic form. A video interview would be mind-grain triggering.
yeah.
With the sessions that you conduct, do you actually have, and realizing with COVID, we're all doing everything via Zoom, but is there an opportunity for people to try out creating a comic of their own, or is it more just discussion and interaction of the comics that you've introduced?
At this phase, it's just discussion, but my dream actually is to kind of emulate what they're doing at Penn State School of Medicine, where that's kind of where graphic medicine started. And there's a physician there who teaches comic drawing to medical students. And the ultimate assignment in that I think it's a 4th-year elective. The final assignment is to draw a comic about an experience that you've had in medical school. And most of these folks have never really drawn before. This is their first time, you know, doing anything like this. But what they say, the comments that are generated, and there is a site for that too, that I can, I should have thought to, I can send the URLs after the fact. But yeah, Dr. Michael Green, he maintains a site of these comics that these 4th-year medical students have created, and they're amazing, and they're incredible. So that is actually something that I started the narrative medicine program at UCF College of Medicine in 2014, and it's really grown in popularity steadily since then and has been very successful. A lot of it has to do with how open and supportive they have been of the work at UCF. But I would absolutely love to do what you just asked, to lead the students in a comic drawing exercise. We do writing, we do a lot of writing, and sometimes students will do little illustrations just because it seems to suit what they're writing about. But we've never done like a full-fledged comic, and I think that would be very powerful. So that's a great question. Thank you.
And thank you to Denise Sheriff. She posted to the chat graphicmedicine.org. That's a wonderful link. Olivia, can you see this while you've been working mainly with medical school students, can you see this transitioning or being incorporated for patients and their caregivers so that you get and also extended family members? Because would this be able to translate out to the larger community within public libraries?
Oh, I definitely think so. I think it's, as I mentioned at the beginning of my talk, I think this is translatable to a wide variety of fields. I feel like I've always believed in the power of art and literature as redemptive forces, and I think that it definitely extends beyond the borders of healthcare and medicine. That's just sort of where it started. And since I work as a medical librarian and at a children's hospital, affiliated with a medical school, that's kind of just how it's evolved. But I don't think it's in any way restricted to just medicine or healthcare. And I mean, we're librarians. This is what we do, right? We read. We love to find things. So I'm always finding stuff for the curriculum. And we have it's sort of like leading a book club. That's sort of the in library, sort of in the library field, that's the most analogous thing I can think of, except it's perhaps a little bit more, I don't know, a little bit more in depth, more revealing, but it's just people really talking about a shared piece of art or literature, something they're experiencing together. So, but it's very powerful. The students and faculty really like it.
Olivia, I can believe that. This is Susan Ariev at USF. One of the things I realized about graphic novels was that when I encountered reading the series called Mouse about the Holocaust.
Yes. Oh, I love that. Art Spiegelman.
Yeah. And I felt that the graphic novel format was able to mute the trauma that was being conveyed to us. Even though it was graphic, he gave us some distance with mice and cats and things like that. And I just felt that it was probably a very good way to express trauma in, about things like very traumatic topics. And I'm wondering if that is probably an element of this series as well in graphic medicine, that there's an element of trauma to what's been going on with people. But this helps give you just enough distance so that you can tolerate the pain, as it were.
I absolutely agree with you. And I think it's interesting too, how it does kind of help mute the trauma, which is an excellent way of putting it. And yet the images really stick with you. Like when you go through your day, if you've read, and you may have found this with Mouse, if you're reading a graphic novel, you'll often start thinking about one of the panels or the colors or something that the artist has done in the book or in the comic. The images really do stay with you, and it's just it's very potent too. So yeah, I'm a big advocate for comics, as you can tell, but we do other, I mean, we read short stories, we'll watch excerpts from films, we will read poetry, anything that lends itself to us encountering it in the room together, because I don't like to assign reading to these folks because they've got too much to do. So, and there's also something very fresh about, everyone encountering it together in the room at the same time. So
in many ways, it sounds like a form of bibliotherapy. And I did have a question for artists about bibliotherapy, and that was whether or not I know for myself, bibliotherapy has helped me over the years. When I was raising a neurologically different kid, books, as a librarian, I turned to a lot of books to help me with some of the challenges in raising a child that's different. So I was wondering if Artis has a list of books or a highly recommended list for particular audiences. And I know that her work with FMHI, and therapy and the actual medical side of things were probably helpful, but I'm wondering about patient lists of bibliotherapy, whether she has any recommendations, or you, Olivia, beyond this collection, which looks fantastic, by the way.
Oh, thank you. Artists, would you like me to stop sharing? I'm afraid maybe it's kind of distracting. I'm just going to.
I like the showing.
Okay.
I don't mind looking and talking at the same time.
Okay.
I have quite a number of lists of and these are primarily books because we weren't doing so much with graphic novels back when I was at FMHI. But we had collections of books that were targeted for different levels, depending upon the severity of the mental illnesses, and quite a number of materials for family members and friends. One of the things that we've tried to really focus on, as disturbing as it is for the individual who suddenly has a diagnosis, I think it's even more fearful for the family members who suddenly have to readjust their thinking of who this person that they've known who's always been this way, who's now somebody somewhat different because of the effects of the illness. So we had a whole series of materials that we would purchase and work with the case managers who were on unit as well as the day treatment counselors so that we always had materials available. One thing that we did, which I guess goes against currency issues in popular magazines, is we would save a number of popular magazines such as Rolling Stone and Glamour and that, which specifically had articles dealing with mental illnesses, trauma triggers, incest, rape, trauma events. We would save them because as popular reading, you couldn't always, there's no giveaway as opposed to reading a book, Patty Duke and My Struggle with Depression. Well, everyone knows what you're reading that about. Whereas if I'm reading a Glamour or if I'm reading a Rolling Stone. And Rolling Stone surprisingly had a number of issues that targeted very discrete trauma events that were very good to use.
I would love to have a session with TBLC or just on bibliotherapy and any curated librarian lists that people want to recommend and talks about various books, because I do think bibliotherapy does, I know one of the English professors at USF, she's every year she does a series called Books Save Lives, and that's Joan Caywell, and she believes that young adult novels in many ways can save a young adult's life. And every year she invites an author to and highlights and has an award for a book that she feels is very good, exceptional bibliotherapy. So it would be great to have just a session on you and experts like you and Olivia with your recommendations, if there are curated lists out there that you think are really good for us to know about, that kind of thing, because this session's been great, but it just sort of piqued my curiosity and interest that much more, which is what these things are supposed to do. So
I would love to do that. I just went and grabbed several graphic novels from my shelf. Just quickly, this is a narrative. This is by Ellen Forney. It's called Marbles. It's about her struggle with bipolar disorder. And she writes, and it's very, her style is can be very manic.
What's the title again?
Marbles.
Marbles. Okay.
This one won the Eisner Award, which is just about the highest accolade that a graphic novel can receive. But this one's called Mom's Cancer by Brian Feast. And this is the story of his mom's illness, her diagnosis and subsequent treatment with cancer. And he does very interesting things with black and white and color. He'll do most of the narratives in black and white, but then he'll suddenly have pages that are really punctuated with strong colors, depending upon what the story is talking about. This is a great one. I use this one a lot with my students. And just one more. This one is one of my favorites, called Stitches by David Small. It's a coming of age story. It's autobiographical about his own struggle with mental illness and that of his family and trying to communicate with them. And his illustrations are just absolutely gorgeous. He is a gifted watercolorist, and he does so many amazing things with facial expressions. There's a lot of this, as you can see, it's well loved, it's falling apart. A lot of it, there aren't even very many words. It's just completely done with illustration. So that's, this can be very interesting too. So yeah, I like to look at a variety of styles. Each artist, author has his or her own, look and feel. They make you feel different ways. So I would love to contribute to another session. Was that Susan that requested that?
Yes.
Yeah, I would definitely, I would love to do that.
Thank you. Those are really, some people are putting some great links into the chat as well to
Right.
help those of us who are unfamiliar to get us started.
Susan, this is Mary Kate. We'll definitely add it to the to a topic to one of the upcoming sessions. So
It
we
sounds like
would be more than happy.
Olivia's, yeah, it sounds like Olivia's already doing a form of bibliotherapy.
Mhm.
So yeah, I just think that that's a whole new area that many of us hadn't really thought about. And I have thought about it in the context of young adults and young adult literature because of Joan and her work with authors and with kids. But there's a whole lot of stuff out there for a variety of age levels and audiences that I'm not familiar with. So I appreciate that.
Well, we have first-person accounts that go back to the late 1700s.
Wow.
Yes. I did a presentation at the center of the book looking at first-person accounts in the United States, looking at reporting of mental illnesses in the United States from a client consumer perspective. And yes, there were things going back to late 1700s.
Amazing.
Olivia, there's one for, and I think it was a graphic novel released maybe 3 to 5 years ago. It was by a parent of a premature infant, and it was, I can't locate the title, and I don't have access to my previous employer's library catalog. But it was about the parent's experience with a child in the NICU. So that's an interest. I'll find the title. Denise Sheriff, just to catch up on the chat, she shared that the University of South Florida Responsive Librarianship Lab is working on outreach of this type with public libraries. So not only in doing a webinar, there may be opportunities to actually collaborate with specific public library sites to be able to offer a variety of experiences.
We're working with, we have different populations at each of the library sites, and we're working with teens and graphic novels at one site, and then using adult combination of fiction and nonfiction at another, and then some family programming at another site. But it's all doing this. So definitely, I'm so glad that we have so much interest in how reading can really help us solve problems and to heal ourselves.
Me too. Thank you. That sounds so interesting. That sounds like a great initiative.
And we worked with Joan actually on a previous project. So there's a lot of synergy here. It's very exciting.
Good. And thank you to Robin and Artis for posting links to additional resources about mental health novels. And
Well, Avocado Press and Madness Network News are historically important because these are a lot of the early disability writings from Avocado Press, which includes physical accessibility and physical disability in addition to mental disability. And Madness Network News is essentially the psychiatric survival literature.
It's good to know that there's a press out there that you that you think is really good. Are we going to get to see your PowerPoints at some point? Because I wrote down some of the resources on one of the slides, but I didn't write fast enough. So I was wondering if those are going to be available, or if the recording is going to be available. I guess I could get it from looking at viewing the recording if we have it.
Actually, Susan, Vicki sends out both the recording and the slides. We're working on getting our slides to her a little earlier, but
well, if some of these links can be added to what's sent out, because they are valuable links too, and the ones that showed up in the chat, because those probably won't show up in the recording or the slides. But you know, the best thing about things like webinars and conferences is how much you learn from each other, as well as from our very wonderful presenters.
Thank you so much for the opportunity. It's been really fun.
Does anyone have any other questions, comments they'd like to share? Because we're coming up, we've got maybe 3 minutes left. So, you know, please, anything you'd like to ask or suggest? Because again, these webinars are specifically designed to create this discussion, because we serve the same patrons. It's just in different aspects, or there may even actually be some crossover. So, you know, we would like to, through the Florida Health Sciences Library Association, establish contact so that we can better network to serve our communities.
I just wanted to comment that I just included a link in the chat to the entire Invulnerable comic series. And it's also available as a PDF from this site. You can download it. It asks you a few questions, and then you can download the full PDF.
Okay. And Robin Grunwald recommended the Hyperbole and Ahab graphic novel for understanding and coping with depression.
Thank you. I don't know that one.
Denise, I don't think it was Kids Gloves. I have to go back. I can remember the cover for the graphic novel for the NICU, but I don't recall the title, which sounds really bad. Sorry. Does anyone have anything else to share? Because I know that the graphic novel I was thinking of is also available in Spanish. So, you know, that way it's, you know, if English isn't isn't a first language, it does provide a.
There are a lot of really great, really powerful comics about, you know, perinatal loss and, you know, premature birth and the NICU and things like that. There's quite a few of those that I use. I just don't know. I guess I'm not quite sure which one that is.
I know, and I'm sorry, I can see it. I just can't find it. So I'll find it, and we'll send it out to.
One of us will find it and share
it. Exactly.
It'll drive us all crazy because we're librarians and we have to find the answer.
Well, and thank you so much. We appreciate, Susan, thank you for suggesting the topic of bibliotherapy as a standalone session, because that will be, we would like to make sure we provide sessions that are meaningful to, you know, that are meaningful to public librarians. And so if there are any other topics you'd like for us to, you know, at least develop a session on, please let us know. We'll be more than happy to do that. Okay, so it's just a little after 1. Anyone have any other comments, questions before we call it? for the day, actually for the month. Okay. Well, I'd like to thank everyone for attending. Appreciate all the comments and questions in the chat. Thank you so much to Artis and Olivia. This was a phenomenal session. And we look forward to working with you all again.
Thank you so much.
Thank you.